Our kids spend so much time in school, so it's no wonder that the people in schools might see and hear things that maybe we at home don't. Welcome into our Hear Me, See Me podcast. That's what we are focusing on today. I'm Melissa Bruner. Hear Me, See Me is a mental health awareness initiative started by us at WIBW TV in Topeka. Trish Backman is with us today. In the state of Kansas, she works for the Department of Education. She is the school mental health coordinator. Welcome to you. How long have you been in that position?
I've been in this position since January 2023.
And did that position exist before?
Yes, it did. And we had a person in that position who has gone on and done other great things and has come back to agency work to continue this, but with a different agency.
Well, stepping in 2023, I think probably was a very interesting time. When we look at, back when I was in school, which was a minute or two ago, probably, you know.
Me too.
Yeah. This really wasn't something that we really taught. We had school counselors, we had guidance counselors. I guess in my case, they were guidance counselors. They were kind of ran the gamut for everything. And you had teachers that you trusted and everything else. How, though, has mental health specifically, to have mental health coordinators, to have mental health professionals in our schools, how has that evolved over the years?
It has really evolved because, like you said, we used to have what we called guidance counselors, and they were career interest inventories. We're going to help you go off and have post-school success. And they did a good job with that. There was nothing wrong with that. But they are also licensed and trained in being able to run small groups and facilitate curriculum. Most of them in the state of Kansas are former teachers. So when we didn't lean into that license and we started documenting and recommending that there were certain services that needed to happen so that we could look at the whole child instead of just academic pieces, those conversations started coming to the table as district administrators and leadership teams. But then when people started having conversations at the tables about suicide and bullying and poverty and what do we do to bring resources to families and how do we connect all those dots, that started bringing in our school psychologists and school social workers. And so people not understanding the roles of those three people in the school, that is my job, is helping people connect those dots and then finding out where are the resources in our communities that are frontier, rural. They don't have the funds or the staffing to have a robust mental health system. So we help them connect with their community mental health centers. So it has become a full circle moment. And I feel very fortunate to be able to just be the person that gets to see it from the bird's eye view and help people connect dots.
Why are schools the appropriate place for this? Because I can already, you hear the pushback. The focus needs to be reading, writing, arithmetic, maybe some science now because it's so important, and computers because it's so important. But we don't look at the other half of it. Why is the school environment an appropriate place to have mental health addressed?
Well, it's most appropriate because we have them for a long chunk of the day. And when kids are with us, one of the reasons sometimes they don't get to stay with us all day is because we have behaviors that used to continuously send them home. And so we were hearing conversations from parents about, are we not keeping kids at school 8 hours a day? Because I have a job and I can't continuously leave my job. We had stories of families going into homelessness because Johnny was really difficult. So as schools, one of the things school psychs do is they study what is the root cause of these behaviors. And so when the school psychs started working with the school counselors and it wasn't just the guidance role, we're like, well, if we put these interventions in place while they're here during the school day, it makes school better. And then we started learning about trauma and what trauma is doing to the brain. And trauma can be many different things to many people. It comes from different angles. But what we know about the brain is when we have trauma and it's unaddressed, people don't feel safe. And school, if we're not at least feeling safe at school, learning isn't happening. We all know that English, math, science, social studies, it's valuable, it's very important. But if you can't get it and we're having to tell a kid 20 times that really their number might only be 3, but they can't get it in there because we've never helped them feel safe, we're working way too hard, and we are seeing it with our teachers with stress. So when we bring the mental health piece in, teachers are feeling safer because students are not as aggressive or we're not seeing behaviors, and learning is happening and we're seeing growth. Dr. Watson presented a bunch of statistics at our conference that we do with district leaders this week. Our graduation rates were at 95%. We are really doing well in Kansas, but it's because we're looking at the whole child. And that wasn't happening when you and I were in school. It was very content driven, and if we did well with that, that was the focus, and that's all we talked about.
What do schools have in place, and what are they required to have in place?
Okay. That is a passion of mine because we know that there's statutes in place. We also know that Kansas law caught up with, and I say that in love, we have always looked at what are evidence-based practices. Because in school, if you're doing things and you don't know if it's going to work, it's like throwing spaghetti at the wall, and we're working really too hard and then not getting results. So we have always recommended from KSDE, the Department of Education, the agency's philosophy is find an evidence-based practice, which means it's been vetted, it's been working for 3 to 5 years. We know research shows you're going to move the needle in this way implementing this. And then use implementation science, make sure you're putting it in place so that people can be successful once they do it, and they're doing it with fidelity. And so that is what's helping us provide programs and services to kids in content and not just one-off topics, and teachers are feeling it's all connecting and kids are being able to move and make progress. Our suicidal rates have gone down in the last 2 years. We've had less completed suicides in Kansas in 2 years. Our numbers, if you look at KDHE's data dashboard, numbers have come down. That hadn't happened for years. And after COVID, we know that giving kids computers, it was a really great idea as a Band-Aid, but it can't be the solution for everything because kids need connections. So do the adults. We need to know that that kid is struggling. And if we don't know that kid's struggling because we're not connected to them, we can't help them effectively. So a lot of full circle moments have come after the pandemic because we look at the root cause of why we're having behaviors, and then we look at what can we do that's effective and then put those things in place.
So back to the original question then. So they're required to find an evidence-based program. So there's no one size fits all for our districts.
Nope.
Okay, so nobody is required to have a school psychologist on site.
There are certain things that are required. We need to have mental health staff that are providing services because we have 3 different tiers that we look at. Thank you for bringing me back to the question. We have school psychs, we have school social workers. In some places, we don't have either of those. So a lot of times that comes to our school counselors. So when we're looking at 3 different tiers of kids, tier 1 is what every kid gets. So mandated reporting training. Every teacher gets that, and we're working on making that better because in my 25 years, the 20 years that I was in the classroom before I went back to the correctional setting, I knew I was a mandated reporter. I didn't exactly know what that meant and how to do it. And when I made that report, what was DCF doing? And now we have better training, and we have those slides that are on our KSDE website so that people can take a look at that. We've been training the districts on what mandated reporting means. Every staff that gets a paycheck in your building has to be trained. Our bus drivers are critical in our mental health world. Our nurses, they see kids that come to the office all the time with upset tummies or they're just really tense. Sometimes that's trauma. Sometimes it's they don't have coping skills. If they're seeing things that need to be reported for abuse and neglect, that has to be reported. We have to make sure janitors, lunch people, everybody is getting trained. So suicide prevention is also in the mandates, as well as bullying prevention. So we have worked in an interagency way of getting training on all 3 of those topics, and now districts are required to submit their evidence of what they have in place and who they've trained to us at the agency, and it's being tied to their accreditation.
And how are those results looking? Are the districts doing this?
This is the first year because
Okay.
we just moved to a new process. We call it KISA 2.0 because we took the monitoring system we have for accreditation and we've amped it up. All 3 of those topics were in one checkbox before, and now they are submitting the evidence to us, and we are saying they have something in place. Here's how many staff they have. Here's how many's trained. They're good to go. Now, if a situation comes up and they're like, we don't know what to do with that, we still tell them, call us, KDADS, Department of Aging and Disability. They have so many services they can implement with schools to partner with them to provide that service outside of the school staff because we can't say that every place has school psychs or school social workers, but they can help facilitate that and help with funding and programs.
So the expense isn't always going to
Yes.
fall back on the school district
No.
if a school district is saying, look, I can't because I'm in Western Kansas. And that's
Right.
the other half of that question. When you find school districts that are having challenges, because
Yeah.
obviously you're asking the question and compiling
Yes.
the data because we know some school districts are going to have challenges and maybe your school's not going to have this. Is it a supply and demand issue or is it a financial issue?
It can be both, and it can also be neither. Sometimes it's lack of education and awareness. that we have all these resources available. Like I said, I was in the classroom 25 years and I knew I was a mandated reporter and I had made reports. But if we don't have awareness that the person who has the evidence, the person who has the reason that we might need to report abuse or neglect, if they're not the person that makes that call, then I didn't know that. I could take it to my administrator and they're going to make the call. But if that goes to court, where the judge has to make a determination on what to do for the safety of that child, I have to be the one to go because I see that. So now we're training administrators. You can support your staff as they report, but you need to make sure that they're the ones that have the firsthand knowledge they're reporting. And then it builds that protection and it builds that system of support, because now the administrator knows this teacher needs these supports for this kid in that classroom. And then they also look at the whole family as, are there siblings? Are there other people that might possibly need supports in other buildings? And how do we communicate that with confidentiality? And then how do we support the family if it really isn't abuse or neglect and it's really a poverty issue? And that's where KDADS, KDHE, DCF, and even our partners at the Department of Corrections are all working together as the 5 agencies to make sure that we're trying to tighten the dots connecting so that kids aren't falling through the cracks.
How does the mandatory reporting play into the mental health piece?
It's huge, because whether it's trauma, whether it is a mental health diagnosis, we can provide supports once that report comes in. If I don't know anything about it, maybe it happened in the community, and that's why our partners in corrections are very important. If we have a family who's had 2 domestic abuse calls in a month, and the school doesn't know that, and Johnny's coming to school and he's sleeping, and we're thinking he's just misbehaving, and we're giving him discipline and sending him home to a setting where he wasn't able to sleep, those are the things where the dots hadn't been connecting. So if we're connecting those dots and we're making sure that kids are getting the services where they need them, even if it's happening outside of school, they can call us and say, hey, could you please handle with care today with Johnny? We don't need to know the specifics, but we need to know we probably need to put some supports in place, and let's keep an eye on, make sure that he's eating. If he needs to sleep, let him sleep, or whatever the need might be. That's why you said earlier, it's very individualized. Our services within districts are very fluid. We have districts that are teeny tiny, like Fowler is one that I use as an example, and they are doing everything because they're taking the whole community approach. And it's not just one person having to do all the things in isolation. They're working together as teams.
I was going to say, how much have we seen communication improve amongst those? Because especially when you balance confidentiality, that perhaps was a barrier, that if perhaps your local law enforcement had responded to something, but then the kid just goes to school the next day, because how does the school know what happened? I recall an experience once, and I won't say where or give very many specifics, but I was reading to a class. It was just like this nice, fun thing. And one child was an elementary level, and one child just out of the blue piped up when we were doing some Q&A stuff and mentioned how someone they knew had kicked in the door at home the night before. And the teachers all kind of looked at each other and they kind of swooped in and took the child for some other questions.
Right.
But how would the school have known if the child hadn't just randomly expressed that this incident had happened in their life?
And there's a lot of times we didn't know, and sometimes we still don't. Education and awareness is huge. So we have our safe and supportive schools working with our local sheriff's departments, our city police, and our school resource officers to get that handle with care message out, so that if something's happening, they're not violating confidentiality with details, but the police are even being informed and educated on, if this is happening at home, it has domino effects that go into the next day with the child. Even if the child we don't think was having anybody physically abusing them, that's their family. Our parents are our parents. We don't always know that what's happening in our house might not be a good thing. But what we do know is I had to go to this office and I had to stay here, and then mom and dad, I don't know where they're at, and then I'm going back to school. So that is happening with our kids that are parents are being deported. It's not always abuse and neglect. We have kids that their whole life gets uprooted and we're not sure why. So we're really trying to tighten those screws and say, okay, if a kid has had their whole rug pulled out from underneath them, the school needs to know, because they're going to have them at 7:45 or whatever time school starts. They need to know so that they can deploy their people to make sure that child's safe that day, because we need to know, what if a parent shows up to the building? Does that become a threat issue? we need to know if there's a separation order from a judge. And so all of us have been working very well together. In the last couple years, I know it has amplified. COVID put a light on a lot of things, and one of them was the lack of connection.
Well, this is what I was going to ask you, is how COVID magnified all of this, because especially when you came in, the whole impetus for this, the Hear Me, See Me, was the 2023 report that came out and said Kansas was last when it came to mental health. That timing also coincided with we're coming out of the pandemic, moving through pandemic. Then you take this position with the Kansas Department of Education, focusing solely on school mental health. What have we learned? How has this magnified? And what happened in that time frame that you came on board to really focus and change some of these things that we're now seeing implemented in our schools?
Well, the day that I heard that was my third day of work, and I went over and Laura Kelly was talking on the platform. Yeah, and she was up there, and here I see our governor, who is short in stature but mighty when it comes to back in school mental health. And she said, our state is being ranked 51st. And I'm like, okay,
yeah, that's
I
beyond
know
last.
My geography. How are we 51st?
District
of Columbia. And I'm like, okay, so, and I'm like, oh, that's my job title. What am I going to do about this? So I am on the Governor's Behavioral Health Service Planning Council. All 5 of our agencies that I mentioned, Gary Hinault at KDAD's got a grant for all 5 of us to go together and learn how to work together so we don't have policies competing with each other. So we've worked with the Annie E. Casey Foundation, and our governor has been so supportive. And so when Governor Kelly said that day, we are going to find ways to serve kids where they're at, when they need it, and whatever they need that moment, so that we can help them develop baseline and move forward. And I'm like, oh, I write IEPs for a living. You know, like that's what I did for 25 years. And I thought, okay, that's not difficult for education. We can take and look at where they are now. And then we need to look at all of our outside partners. And I really feel everybody wants to do the best they can for kids, and nobody wants to feel defeated walking in the door. We are leaving no stone unturned. And so people are not hesitating to reach out to another partner at another agency. I get calls all the time about, what do you know about this topic? And I'm like, well, a little bit, but here's the person that I know that knows a ton about it. I'm going to connect you with them. I do connecting emails every week. And that is where the barriers are getting knocked down. We're not afraid to reach out. And I think that the next step, and our governor has worked really hard in having people try and also reach across the aisle. We have people who have worked together to make sure our MHIP program has stayed in place. Our dream, my dream, and I know KDAD's dream is every school that wants it would love to be able to have access to it. Right now it's a proviso bill.
And that program is?
And that's the mental health implementation teams, and it was at KSDE, and it last year moved over to the Department of Aging and Disability Services. We were able to bring in outside connections with the community behavior health centers. And they can not only bring those connections in, but they can bring it in if it's a substance use disorder, or if it's a mental health diagnosis, or if it's an issue where families need help with transitioning so a kid knows how to transition successfully out of the home after they've had Medicaid services. And so making sure they know where their services and supports are, because when they turn a certain age, they have to advocate for themselves. So now it's a full wraparound service. But since it's a proviso bill, only certain schools get access to it because you have to apply because it's still a competitive grant.
So it's in how many districts now?
Last I knew it was over 90. I don't know the specific number.
But we have how many districts in Kansas?
We have 285 this year.
Yeah.
We had 286, but our population is dwindling, and not a lot, but the services we hope are increasing. Mm-hmm. So we're hoping we can get them to everyone, like she said, where they need them and when they need them.
We are going to walk through the specifics of what happens when someone either gets that mandatory report or that suicidal ideation piece. We're going to walk through those specifics so parents know what happens when those things happen right after the short break. We're continuing our conversation with Trish Backman, the school mental health coordinator for the state of Kansas, on our Hear Me, See Me podcast. We've talked about a lot about the services that Kansas has, the things that our schools are doing. Let's go through what happens. So we talked about mandatory reporting, and that is when someone spots abuse, neglect, in particular, I believe suicidal ideation. How does that play into the mandatory reporting issue, even if it's not necessarily in the law? What are the requirements there?
Well, anytime we think somebody is being abused or neglected, that's where we call DCF and we say, hey, and they have like a very specific list of questions that they want us to kind of gather information on before we make the call, which is a really great time for staff in a school to collect, okay, we've had this many behavior referrals, and then you start seeing patterns and trends that you're pulling information from outside places all together at one spot. And that is what some of our social workers and school psychs do if we have them in place. And sometimes without that mandated reporting, we don't realize, oh, there may have been suicidal ideation. Or one of the topics that we address in our new toolkit is bullycide. So if we heard that this kid had this comment made to him from this person, and this person, but we didn't have, it's once this kid said this, so we didn't think it was bullying. But now we see that there's 3, 4, maybe even 5 kids that have made this comment, and now that kid is feeling like they don't want to live. That is a situation where if the parents know this and they're not telling us, is that risk? Is that a perceived issue with safety? So then we can reach out to the families, and instead of having to call DCF, we can say, hey, we have these places that we can help with helping your kid build resistance and resiliency skills, and so we aren't going into full-on suicidal attempts, and we can build supports and strengthen them with some skill building, and then it avoids DCF having to be involved with abuse or neglect, and we're supporting the family and the child, so it actually decreases some of those mandated reports that we have to make because we're now putting those services in place at the school, sometimes with our MHIT liaisons that we talked about earlier.
Yeah, so abuse and neglect, I think is pretty clear. You contact child welfare,
Yep.
They're going to launch an investigation, the family. When it comes to something like the bullying and the bully side, one criticism that we have heard, so please enlighten us on what schools are being trained to do, is that we'll actually hear school district respond, well, it didn't happen on school grounds, therefore there's nothing we can do.
Yes.
Has that attitude changed at all? If so, how? Is it varying district to district? Because yes, it's very true. We have cell phones, we have social media now. And so whereas when you and I were growing up, we'd go home and we could leave it where it was, whenever. Now it can happen 24/7. It can happen in the middle of the night. And yeah, it's not happening on school grounds. You know, if it's not a kid pushing another kid in the hallway or yelling at another kid in the hallway, it's not happening on school grounds. How are we seeing that evolve? Are we seeing it evolve?
We are seeing it evolve. We have coming out in the next few weeks, it's in our branding department right now at KSDE, a toolkit that gives templates for what schools can do to monitor bullying. So in Kansas statute, it says it has to be severe, persistent, or pervasive. So severe can be those comments where we hear somebody tells a kid, you should kill yourself. That is severe. You don't have to say that more than once. That is really severe to say that to somebody. So we work with the person that makes that comment, but then we also work with the person that's receiving comments like that. That goes on some of the documentation that we're keeping now. If it is persistent, it can be me saying something to one person over and over and over again. I would be a bully if I'm doing that and not even thinking about what that could be doing to that person's self-esteem. I need skill training because you shouldn't treat people like that. And some adult needs to come alongside me and go, we don't behave like that in this school. That's not how we act. What would be the reason that you think you need to say that to that kid? And then pervasive would be the comments like if you're in the lunchroom and if you're a 12, 13-year-old girl and this person says something and this person says something and this person's, and you've got 5 or 6 people saying something to you, even if they don't even know the other person said it, you're thinking everybody knows something about you and maybe there's something out there, especially on social media, and then it takes up to, in the evenings, they're all over that at night. It's affecting the next day. So if it's pervasive, that is something that the schools are now saying, okay, we need to get this documentation together, and then that would be a situation where we're gonna go and talk to the 7 people that this person says are making these comments to them and say, what is the story behind this? Why are we talking to our classmate like this? Or why are we treating another person in our school this way? We are working on skill building. Skill building doesn't just happen during the day. We don't teach our kids things that we're giving them permission to forget. If we're talking to them about problem solving, we want them doing it in English, math, science, social studies, and at night at home on the internet. So whatever happens in the evening on the internet, it comes into the school the next day. And we can't put our blinders on and act like it doesn't affect. It's just like if we have a domestic abuse situation going on in the evening. the police are calling to let us know so that we can help that kid provide safety the next day at school. So schools have to sit back and look at, this is something that we have been told, and if we're saying we're not going to do anything about it, are we implicit? Are we liable for not putting any actions together to help support that kid, whether it happened in our building or not? We've had some schools who've had suicides during the summer, and one of the things they tell us is we need to have those wraparound supports like we do for kids who have an IEP. If we know that they're going to possibly regress with services if they don't have them over the summer, we maybe need to look at what we do with our mental health services, and they need to be provided over the summer, because that's 3 months that they may not have an adult that they can say something to. So there's a lot of different angles. Schools are looking at this very differently now.
Are they going to feel empowered to take disciplinary action against students for incidents that happen outside school hours?
What we're looking at is not necessarily disciplinary action, but we're asking parents to partner with schools and say, if your child is participating in these behaviors that are by law bullying, are you willing to let us do skill building with them so that that behavior decreases and hopefully eliminates? Like, what is the root cause of why these behaviors are in place? And if we can't do those things with them at school, work on problem solving, good decision making, being a good citizen, then we will ask parents, can you please implement these things outside of the school? If you're not willing to let us work on these, how are you going to strengthen and support that so your child isn't engaging in those things? Because there comes a place as a parent, if this is consistently happening and other parents are not letting us engage in helping that student, I have a right to call law enforcement, because now it's harassment. It could be intimidation. If it is making it a threatening learning environment, that by definition of law in Kansas statute is bullying. So if we can't as a school act because we don't get permission from one side or the other to actually help them with skill building, is that becoming a situation where that kid's now like a threat to the safety of our building? Because when we don't act on something, that safety risk escalates.
I was going to say, skill building's great, but you still have the problem of, and what we hear from families is, you still have the bully not able to be suspended or expelled, regardless of if you're doing things with them or not. So they're still in the same environment with the person who is being affected, their mental health, their well-being, their ability to learn and function on a day-to-day basis, because they have to interact and still encounter this person. Is that going to change?
There's something I want to clear up there. They can suspend, they can expel.
They could.
They always can. The law says you may and you can, but it doesn't say you must. And so what we are asking schools to look at, just like, and I always go to special ed because that's what I did for 25 years. If we look at how we help kids grow and mature and develop, sending them home and then not having adults engaging with them, that's not ever part of the equation. So what we're asking schools is, okay, Johnny has been accused and convicted of bullying, like if you wanted to look at it like a court case. Okay, so when we expel a kid or we suspend a kid, it becomes like a sentence. So if we say that they're going to instead, on this day, we said, yes, this is definitely bullying and we think it is severe or we think it's persistent, we are going to take, and what setting can you have Johnny go to? Because this kid needs a break. Schools usually separate schedules. We have tiny districts where that's not always okay, so what's another setting that they could attend? Are they going to be working with that guidance counselor? That is one of the things they can offer. Is the social worker going to be helping with tier 3 interventions? It's not going to necessarily be in the same setting, because we know separation is very important, because you sometimes need that to heal. You don't have to keep the kids in the same classroom. You need to work on a safety plan. We have Stanley Brown safety plans in our suicide prevention document, and they're going to be in our bullying prevention. Because if a kid's not feeling safe, what is the safety plan to help them feel safe? And usually it's not being around the person who's antagonizing them. And if that kid just doesn't comply with that, then that can be a situation where the police get involved. But we want kids to be maybe in a different setting, but not expelled and not allowed to come back in.
Not isolated.
Yeah,
Okay,
we don't, because isolation and loneliness and lack of hope are those identified risk factors for suicide.
Now we've flipped
And
the
so
script, and
now-
the offender
Exactly.
is
Now the person who was doing the bullying is the one that we're now having risk for. And then if that becomes suicidal ideation for a bully, it doesn't always become, I'm going to just do this to myself. And that's where John Calvert, who's with our school safety and security department, he talks about, you want to put the fire out with a fire extinguisher, maybe a fire blanket. We don't want to have to call the fire department in with a full 5-alarm fire with a hose and like all these responders. We want to get them the support as soon as we can and as early as we can with the least intrusive invasion of their education, because we also don't want them lacking credits, because that becomes the domino. And you see all these things that just start connecting to each other. And that's where we rely on KDADs and Department of Corrections. Sometimes if a kid ends up going in front of a judge, they're going to have a probation officer. Well, guess what? They can sit at the probation office and we can have people come to them and we can provide school in the probation office. Sometimes they have a room where kids do their education, because some small schools don't have an alternative school. They don't have other offices. They don't have things to offer, but the other agencies do. And that's why we come back full circle to all of us working together and providing families and communities and kids what they need.
Let's move on to then, if there is suicidal ideation, what happens? For parents out there who might be wondering, you know, we think we know our kids, but sometimes kids are really good at hiding things. So if something happens in a school, teacher, other professional, maybe a friend sees something, what's going to happen?
So we've had all kinds of schools get really creative with how the kids can tell them if they're struggling. And I have a plan with all my daughter's friends that if somebody's having a hard time and they just need to kind of talk through it or process, or they're really thinking they're going to do some action on what they're feeling, that we can text any of the parents in our group code blue. I'm not asking questions, I'm going to say, hey, where are you? And so parents can have those protections in place. Schools have protections very similar. What the philosophy is with building that safety net is, if you think a kid is at risk, you stay with them. There are several staff members that are like, this makes me so anxious because I am not trained and I don't want to ask these kids these questions. I'm not comfortable. If I know this, I don't know what to do. And that's okay. Your role is to stay with them. Call whoever in your building. Maybe it's the secretary. Usually it's the secretary. They are the knower of all things in the building, and say, hey, I have a kid that's really struggling and I need somebody to come down and offer us support. That person is going to be trained, and they're going to say, okay, we're going to look at the guidance counselor, we're going to get the principal, we're going to get whoever it is, and they're going to come in and they may help with asking questions. But the person that was with that, we're always reaching out to the parents first to let them know this is going on and we need to ask, we've asked some follow-up questions, or we need to ask some follow-up questions. Can you please come to the school, because we want to wrap around and show your child we're all on this together and we want to work together for safety. There's sometimes parents will refuse to do that, and we have protocols for that too. If that happens as a school, that's a kid that's at risk and they're telling us they may possibly want to die. We have a responsibility to get them to the help that they need. And if a parent's refusing to offer that for their child, that's where the resource officer, that's the only time we ask them to come in, because they can escort kids safely to a place where a licensed, clinically trained professional, not an educator, who is not trained in that, can ask them the questions that they need to go through to find out what is going on and how can we keep you safe. We want people to stay. We're working on platforms like 0 Reasons Why, and making sure that we have all these initiatives where kids feel connected and they can have a place where they can thrive. And so they can help us and get information to us, and then we can help them find those things in the school. But we want the licensed, clinically trained people to do that work with a warm handoff. Our job a lot of times is stay with kids, let them know that we are their safety net in the building, and then we help connect them and their families to where they want supports.
And you will let parents know.
Absolutely.
So it's not like something happens. It's kind of sad to hear that sometimes parents will refuse to listen and get help.
There are sometimes parents just don't have the bandwidth because they've been dealing with serious things at home, and now it's gotten to a place where other people know it. And so sometimes it becomes a place where the parent just disconnects. It's very rare. We have very rarely had those situations, but sometimes if it's a situation of abuse or neglect, parents may think it's a reflection on them. A lot of people are like, oh my gosh, I'm looking like a failure. I failed my child. And sometimes we have a hard time as adults thinking we know everything about our child and we missed something. There can be so many different reasons why that happens. But we don't want that to be an issue where we send a kid home and then something happens and we didn't help keep that kid safe.
And for anyone listening right now, 988 is a great resource. It's that 24/7 crisis lifeline, not just for you to call yourself if you're in crisis, but also if you have a loved one who you feel is in crisis, they can help walk you through the steps and what you need to do. It's obvious you're very passionate about this, Trish. What makes you so passionate about this work?
Well, in 25 years of doing this, I've lost students to suicide. I have family members that we have had attempts. We have had people who have been attempt survivors. We have people that when you have conversations and get to know people, that you soon realize they're in your inner circle. It's not an outer circle. Most of us have 1 degree of separation from somebody who struggles with this every single day. And so when I sit in a classroom and I have kids that come to me and I know that they're walking in with math issues, but it's not always just math issues. The math issue gets this big because there's something else underneath here that gives them a 0 frustration threshold. Well, let's figure out what that is so that when they get to a problem they can't solve with numbers they've been dealing with since 2nd, 3rd grade, we can help them problem solve and get success in those areas, and that helps them feel confident, that helps them build self-esteem. I've seen kids overcome some very serious things, and I know it can happen, and I'm very passionate about it because every educator that walks into a school building, they believe that too, but sometimes we don't give them the tools to see the successes, and we end up attending funerals, and nobody wants to do that. And if I can help empower schools to do what they need to do, that's what I want to do. That's the only reason I left the classroom. I would be with kiddos still today if I thought that we all felt equipped and tooled. But I know that there's so many things out there. In Kansas, we have a badge that we wear. It says Kansans Can. I wouldn't wear it if I didn't believe it. And I also see us. We go to conferences and we're taking our suicide prevention toolkit, the bullying prevention toolkit, mandated reporting, talking about the interagency collaborations. There's other states modeling after what Kansas is doing. So I know that we are leading a lot of initiatives, but we also are doing that because we leave no stone unturned. And that's what fuels me. If people still have places where they're like, we have a gap, let us know, because we go out there and we just try and dig and curate resources, bring those evidence-based practices. We want people to feel like they have what they need so that they can do what they need to, when they need to, for whoever they need to.
So schools, school leaders, school administrators, if you're listening, they want to hear about the gaps so they can fill them. Parents, if you're listening, know that your schools are becoming more and more and more equipped, is what I'm getting from you. There are new tools that are being put into place. You're getting new data, new ways to track that data this school year so that we know exactly which schools maybe need a little bit more support, which schools are ahead of the curve. So much going on in our Kansas Department of Education and really in schools across the country, because that's where kids are, right?
Yeah.
I mean, we talk about that with our workplace
Yes.
all the time. You spend more time with your coworkers a lot of times, more waking hours
Yes.
with your coworkers than you do with your families. Kids are the same way. They may spend more waking hours in school and in school activities than they really do at home with you. So take advantage of the community that we're building around each other.
Yeah.
And Trish, your work at the Kansas Department of Education
So
is doing
another
that.
person that I didn't mention was Keisha. Keisha has a mental health toolkit.
That's our State High School Activities Association.
Yes, and they're right around the corner from your office here. And so when you think about the people that we have actively involved, those are a big group of people that we sometimes don't look at that may be struggling with mental health
And you're
issues.
looping them in now.
And now we're saying, you know what? That head cheerleader, that person that is the star on the basketball team, they lose games. They sometimes put their value in that sport or that activity they do, and we can't leave that stone unturned. So there's toolkits everywhere, but what we want is we want people to know connection is key. If you don't know what to do, the first time that I had somebody really close to me that was struggling, I called 988 because I said, okay, I'm telling people at my job all the time, call 988 if you need to talk through. And I said, I just would like to know if they call, can you run through it? What are they going to tell me? Every parent can call. If you're nervous about what they say on the other end, or you have, listened to maybe some false narratives or some information out there that they're saying things to kids, call. Find out. They want you to call. They have people all over the state that have been given more than 100 hours of training to answer that phone. Veterans, if they call, they can press 1. So our parents that have PTSD from serving our country, they can press 1 and get veteran-specific services at 988. We have so many great resources out there. We just want people to know where they're at.
Well, the tools can't do any work if they are left in the toolbox. So take them out, because we want you to know. Trish, thank you so much.
You bet.
We want
Anytime.
everyone to know that we hear you, we see you.